Hello, I'm Ola.
And I'm Jean.
We work together. We wrote a book together, and today we're going to discuss on this video cosmetic treatments that we both have had. Jean, would you like to start?
Mine's a bit of a longer story, but I met Dr.Olha 8 years ago now, was recommended to see her, and walked into a clinic before even Angels 12 existed, and she just rented a room, was a full-time dentist then, but we just kind of hit it off straight away. We are different age groups, we are different cultures, we come from different countries, and we just kind of, it worked, didn't it? And so I trusted her implicitly with my face, and she answered all of the questions that we've talked about in our other video, and that's when it started. So the thing that bothered me most, which is really what most people come with, I don't like the lines around my mouth. I just need that little bit of a lift. And that's where I started. And as things have progressed, you've lifted those areas in different ways as the protocols have changed with the products that we use. The products that we use have changed.
Absolutely.
So, and all for the better, because now I just have treatments once a year. That area still is the bother for me, and I know that I'm coming up due now, which we always seem to do the videos when I'm ready to have a bit of a lift. But so ready again now for probably a top up. I prefer to have my treatments done all in one go. I would rather just get the enjoyment of the full result
and have a full result
and have it all together. It's not the right thing for everyone. You know, whatever you're comfortable with is how we can plan out treatment. But for me, starting at the top, temples, upper cheeks, tear trough, which was also fixed with carboxytherapy before I ever had any fillers. Again, just check out the photographs of those. Mid cheeks, because of my age, I don't carry a lot of weight, so I have a tendency to sink in there, which again is quite aging. My jawline has been kind of created rather than it being there at all to start with. A little bit in my chin, a little bit in my lips. And the first time that we did it all in one, going back to how many mils, we did 11 mils that year. This year... But
it was in two separate settings first time. It wasn't all at once.
Yes.
So it has been in two
sessions.
2 stages.
This year, you're probably thinking, I might need 5. Yeah. So that kind of shows that some of the treatments that I have last longer than others. And again, things don't get worse if you don't have it done. So that's me. But I do believe if I didn't choose to tell people and share that story, you wouldn't walk past me in the street and think...
Absolutely not. No one guessing what you have had. The people only say that Jean looks younger and younger every time they come to the clinic. And I know, Jean, you focus a lot about dermafiller treatments, which I think probably your favorite.
It's my favorite.
Your favorite. But could you tell and open a little bit more about what are the treatments you have had, because you experienced different treatments through the years?
Yeah. Different treatments, different products. Dermafillers are my favourite. I have minimal anti-wrinkle injections. I'm quite sensitive to different toxins, so Dr.Olha is very careful.
And we found the one that
works. We found one that works.
Yes, we found
and we found one that suits me. I wouldn't want the frozen forehead. No. I think especially in someone my age, it then kind of enhances everything else. So, but along the way, until we found this toxin that does suit me, I had kind of thought, I'm not going to do that anymore. It's what I like about it is outweighed by what I don't like.
Yes.
So that was one consideration. One product that we used in my lips, through no fault of anybody's, but just the way that I reacted to it, it didn't settle very well. So I had thought probably I won't do lips again. But the product that we're using now, which is Marley, is much softer, it's very subtle. I have absolutely no problems with it. So from going to thinking, I'm not going to do that again, it is something that I don't worry about doing. The only thing I would say I regret having done, I had microbladed eyebrows.
I was going to ask you this question.
And that's not for me. So I understand with people that there is a need for this treatment, but again, going back to get recommended to somebody, get somebody that's well trained, well experienced, is a good artist, because it's very permanent. Even though it's called semi-permanent makeup, 5 years later, I have still remnants of the treatment that I had done. PDO shreds I've had along the way, different brands of those. For me personally, not that I didn't like the results, I did like the results, but I do feel that with the derma fillers we use right now, that I get as good a result with the fillers.
But also, Jean, you are now in maintenance stage.
Yes.
So, and the factors that we have did threads on multiple occasions, and you have had filler on a regular basis, allows, as well as, I think you forgot to mention, you have had collagen stimulating treatment.
Yes.
And La Luma for the neck.
Yes.
So all those, it's a compounding effect. So, and you very good with your skincare, and now you're taking oral supplementation.
Yeah.
So you're doing everything to wake up this gene of longevity and usefulness. So I think that is why there is no more need for you to have a PDO, at least in foreseeable future.
Yeah.
And we'll see how the aging process takes over with time.
Yeah. I'm going to give the question back now.
Yeah.
Will you just give a little talk on your treatments? People don't always ask you. They'll ask me what you've had, but they don't always ask you.
I think sometimes people question if I have treatment, because some people think that I'm younger than my age, but I'm very proud of my age, and I don't ever understood why some people hiding their age or don't want to relieve their age. I turned 40 this year, and I'm very comfortable in my skin, in my body, and in my look. And I do have cosmetic treatments. I don't think early. I believe I started at the right time. So my first experience was going back when I was 20. And it was just this niggle, which I always wanted to do, but I haven't been kind of brave enough to do it. It was a lip filler, and I thought about it. I booked appointment. I cancelled appointment. I went for a consultation. I didn't go ahead with the treatment. And I think because it is quite a big step. So at the age of 25, I have had a first injectable treatment, and that was derma filler in my lips. Those who see me in clinic and know the history of how Angels 12 has been built, you know that my husband Lawrence was the first who actually started to do cosmetic treatments, and he was the one who first treated my lips. And I fainted, and not because it wasn't painful, and I have had a very high pain tolerance. I think it just was anxiety because you have done something to your face. I fully recovered, and he completed the treatment, and I was very happy with the results. I started also around age of 27 having a preventative Botox injection around my eyes, and from the age of 30 I have frequent anti-wrinkle injection on the upper face because I know if we relax our muscle, we slow down signs of aging and formation of dynamic lines.
Because you can't tell when you've had your treatment unless you tell me I've had my Botox, this anti-wrinkle injections last week, I wouldn't know.
So I still can smile, I can raise my brow. The only thing, like frown, not as easy, but I don't think it's expressions that anyone missing. I have been very good with my skin. Around age 16, I have had regular microdermabrasion, facials, and then from the age of 25, I started to have also medical microneedling, chemical peels. I have minimal injectable treatments. So I have had a filler around my cheeks twice. And the last time it was 5 years ago. It's actually just after I have had twins. When you are having babies and twins, it's completely different level. You need all help to look fresh. So I have had like mini non-surgical facelift where I had some fillers around my cheeks, jawline and chin. I think it lasted very well, but also with regular skin treatments that I have, radio frequency, facials, it helps to keep the natural collagen in the skin and the lifting effect. Probably the most invasive treatment I have had up to date was a thread lift, which was nearly 2 years ago. And I was on my annual upskill training with fantastic practitioner down south. And I always wanted to try because I believe I need to experience what my patient have and know exactly how the treatment works. So I knew that if I would have this procedure, it needs someone who I'm absolutely trust implicitly. And I have had the treatment, which gave me a very great result. I have been very happy with it, but I also think I have been completely in the patient's shoe next day. I just felt like my face was a bit swollen, puffy, tender. And you just have this thought, gosh, what I have done, despite all this process, you're explaining it all to the patient, but within 2 weeks, it all was great. And I would definitely say, for me, I would consider it again because I have the right volume in the face. What I just need is maintain the tightness. One of my favorite treatments, I definitely would say it is muscle relaxant injection, and especially with the products that we currently use. To be honest with you, I hasn't been a great fan of muscle relaxant before because I'm very sensitive to any medication, and Botox is medication. So it's the result I liked, but the feel I didn't, because I constantly felt restricted and heavy. I have had this feeling of heaviness. With current products that we use, I feel very light. I don't feel that I have had the treatment. It's just it maintains the minimal appearance of the lines, which I'm very happy. And I also have it around the neck to prevent formation of the turkey neck and gels. I'm a big fan of microneedling. I do like PRP. I'm good with the skincare. I'm taking supplements. So basically, guys, we're having it all.
And we try everything.
And we try everything, but in a reasonable way, which keeps us happy, keep us looking healthy, useful, and keeps our patient asking what we have had, if we have had anything. So I hope you enjoyed this episode, and if you have more questions about which treatment Jean have had or which treatment I have had, or you might interested what treatment will be right for you, why just don't drop us a message and we will be very happy to advise. And also more answers in our book.